Angeles.
Well, let's talk to Annalee Baker, who is Professor of Emergency Medicine at New York University, and she joins us live from Fort Lauderdale. Annalee, thanks so much for joining us. What do you make of President Trump's motorized walkabout outside the medical center? I mean, his staff said that that was okayed by doctors. Sounds quite strange that it was.
It does sound strange, and thank you for having me this morning. You know, all of us physicians were quite surprised to see what happened yesterday. Certainly, any typical patient hospitalized with the severity of coronavirus symptoms, as the president was, would never, ever be allowed to do such a reckless thing that would put others at risk. I can't speculate about the reasons for it, but I certainly can't see a medical indication why that was necessary, and it certainly does not seem that it was perfectly safe.
We're hearing that he might end up returning to the White House at some point later today. What do you think about that, if that does go ahead, given the severity of the illness and also his age and the other factors? Are you surprised by that?
I am absolutely very surprised by this. One thing we have learned about this virus over the last 6 or more months is that it is a very unpredictable virus, and it does typically present with a protracted course. We are not talking about influenza, where we can reliably tell patients that they'll be ill for about 5 to 7 days. Most of our patients who have coronavirus symptoms that are severe enough to require hospitalization, supplemental oxygen, the medications that you mentioned just prior that he's taking, are certainly in no condition to return to such a vigorous schedule, campaigning and just running the country in such a short period of time. So it's very concerning for us to hear.
So
of course, we're not privy. Oh, pardon me.
No, pardon me. I'm so sorry. What would you advise if you were the president's doctor?
That's a very difficult question. Given the very limited information we've been getting and some of the mixed messages from his medical team over the last couple of days, we're struggling to make that kind of a call. Based on what we know, given that he did require oxygen at least once, and that he is on dexamethasone, which indicates he has moderate or even severe disease, I would be advising my patient to go home to rest, to recuperate for at least a couple of weeks, in the case of somebody who required that much support, sometimes even longer. We have some COVID patients who honestly are still symptomatic even a couple of months out. So it's unpredictable. We're not quite sure how he's going to respond over the next several days to a week. But I do know that the more strenuous the more he exerts himself, the more strenuous the activity, that certainly puts him at risk as well. He needs to be resting.
How sorry do you feel for the medical staff at the medical centre? Because it's difficult, isn't it, when medicine and politics have to end up mixing in this way?
I think that's a very insightful question. We have often commented amongst ourselves, various physicians have said the same thing, and I've thought the same thing. Typically, as a physician, we take an oath to our patients. We take that oath very seriously, and we put our patients' care above all else. So to even think that as a physician you would have political pressures or a voice in your ear sort of influencing what you say, but also even treatment decisions, is just unthinkable, and I hope that's not the case. I do know that his physicians are excellent physicians. He was in a great hospital. I assume and hope that he was getting the best possible care, but as we all know, doctors are human. So if they were susceptible to any of these numbers of pressures and it had any effect, that would be extremely tragic.
Okay, Dr. Annalee Baker, thank you so much for answering our questions today.
Thank you for having me.
All